So we are a full-fledged financial planning firm. My specific role and what I specialize in is small business retirement plans. So your 401k plans, your 403b plans. I am the advisor and help work with the business owners to create and design the appropriate plan for them and their employees. I do all of the education and onboarding, and then work with the various service providers to provide the ongoing compliance with the Department of Labor and the IRS.
Oh, thank you, Brett. Ryan Dixon.
Hi, I'm Ryan Dixon. I'm the Maricopa County Small Business Advocate, and I run our small and local business advocacy program, which helps small and local businesses do business with the county through the Office of Procurement Services.
Thank you. And let's do Thomas.
Hey, thanks, Trish. My name is Thomas Prouse. I am the owner of the Grease Monkey Automotive Services on the corner of Mesa and East Broadway. And we do all of your preventive maintenance, and we do automotive repair services as well. And I believe late March, we'll be adding alignments, wheels, and tires. We're just waiting on the equipment to be quoted and installed. So glad to be on.
Thank you, Thomas. Erica Macbeth.
Hi, I'm Erica Macbeth. I own a advertising and marketing agency in Phoenix, Arizona. Sorry, not Phoenix, in Mesa, Arizona. I'm just down the street from the chamber. And we really specialize in helping small businesses.
Thank you. And Brandon.
Good afternoon. My name is Brandon McMillan. I'm the recycle and solid waste service provider. I'm located in Mesa, but also cover the North Deer Valley area location. I am serve as the division sales manager for Metro Phoenix, and so here to service all your solid waste recycling needs and such, all the way up into electronics recycling as well.
Perfect. Thanks, Brandon.
You're welcome.
Jen.
Hello, I am the Jen in Gen B Marketing. I also do marketing, and I focus on coaching, consulting, and helping you learn how to do your marketing.
Love it. Lynette Carrington.
Hi, I'm Lynette Carrington. I'm the PR and marketing specialist here at Times Media Group. We're HQ'd in Tempe, technically, but we've been in business for decades now, and I am in charge of doing special events, all public appearances, any event sponsorships, event partnerships, and anything else having to do with any type of marketing with not only Times Media Group as an umbrella company, but any of our 17 Arizona publications that are either digital or in print. They're both, and or 60 publications in total between Arizona and Southern California. Really glad to be here. Thanks, Trish.
Thank you. Karen.
Hi, I'm Karen Martinez. I own Peppy Paws Play Yard, which is a private doggy playground in Mesa. We have lots of space for the dogs to run around and play, one dog family or friend group at a time, and we're opening a new scent space for a new thing for the dogs to do.
I love that. Mary Lou.
About that. Hi there, I'm Mary Lou Ruiz Gray, and I am the general manager for Superstition Springs Center. And that is the mall here in Mesa. There's so many Superstition Springs, everything that everyone always asks me, what does that mean? So we're at the mall.
Perfect. Thanks for joining us. Emily.
Hi guys, my name is Emily Bates and my business is Queen Bee Home. My store is primarily online, but we do have a location in North Mesa out at Falcon Field. My store specializes mostly in custom gifts and home decor with an emphasis in laser engraving and UV printing, as well as handmade wall art. I'm a self-taught woodworker, so if you can think it up, I can create it. I've been in business for 10 years. I was a former teacher, enjoyed doing creative things on the side, and it just fell into a business. So thanks for having me, Trish. Good to be back.
Awesome. Thanks for coming, Emily. And Stephen.
Oh, I didn't know if I was going to be allowed to do a quick intro because I showed up late. Thanks, I appreciate it.
No problem.
Stephen with Elevate Experiences. I actually focus right now on helping businesses with improve their organizational processes, workflows. Specifically, a lot of people are interested in what can I do with AI? And the answer is a lot, but it depends on your business on really how it's going to play out and how you can really see an impact from it and actually get an ROI and not just, I always tell people not just write a funny poem because that's what a lot of people use it for is write a funny email for me to this person responding, make it sound like I'm in Lord of the Rings. And there's a whole lot more that you can do with it. So that's what I help businesses with.
Great. Thanks for coming on here, Stephen. Mr. Tobin.
Hey, sorry, I was running a little bit late too. Had some people that popped into my office. Ed Tobin with Next Wave Business Services. We do payroll administration, and human resource. We handle all of your needs for any kind of payroll administration and the things that go along with it, like workers' compensation and benefits and HR.
Perfect. Thanks, Ed. Thanks for coming on.
Thanks, Trish.
Absolutely. All right. So, Dr. Sherman, you are our first presenter. If you would be so kind to share your screen and let's get started.
Sounds great. All right. So, everyone see my presentation okay?
Yes.
Awesome. So I'm Dr. Jayme Sherman. I'm a board certified family medicine doctor, and I own Engage Health, which is a direct primary care office in Mesa. I am located at Higley and Broadway, so just north of the 60. And a little bit about me. I am a fifth generation Arizona native. I grew up in Mesa. I went to Mountain View High School. I graduated and went down to the U of A in Tucson for an undergraduate degree in biomedical engineering and realized quickly I did not want to be an engineer and became a doctor instead. So I came back up to Phoenix to go to the U of A's medical school here. And then I did my residency at Banner Good Sam, or now Banner University Medical Center, as it is called, since they merged with Banner. And my hobbies include reading a lot of fiction novels, especially science fiction and fantasy fiction. I love to bake, especially cookies and brownies and things like that. And hang out with my 1.5-year-old and my husband. Our little boy's name is Lucas, and he is super fun. So that's just a little bit about me personally. I also realized quickly during my training and my experience working in healthcare that a lot of people, myself included, because I'm not only a doctor, but also a patient, realize that the healthcare system is kind of broken and frustrating and has a lot of issues with it. Some of the things that I've noticed as the doctor side is that I couldn't really connect with my patients that well because I didn't get a lot of time with them in the traditional healthcare setting. I only got 5 or 10 minutes in the room with everybody, and that really wasn't enough time to get to know them on a personal basis. And I was spending probably my whole day seeing 20 patients a day and going home and charting for another 3 or 4 hours. And that left me really overworked and stressed and not emotionally or physically available for my patients. On the patient side, I don't know if you guys want to make this more interactive, but I'd love to hear what frustrations you have all had from the healthcare system. If anyone would like to jump in and share, or if you want to put it in the chat, you can do that too.
I would say that whenever I go to a Banner facility, that the experience and the customer service is so bad that it makes me sicker than I am when I actually got there.
Yeah. So it can be really hard when the customer experience is terrible. Absolutely. Whether that's long wait times or not feeling like you were heard, all of
Whoops.
that.
I think I just hang on, guys.
And I'm not just picking on Banner. I think that's the situation with almost any of these places now. There's no customer service. Nobody is going to have the same doctor for long periods of time because they're all changing networks. My mom says stuff like, hey, my doctor's going out of network. And I'm like, Mom, you're never going to have the same doctor every 2 or 3 years. It's never going to happen like that ever again. So doctors leave networks in the middle of the year after, people set their insurance up, and they're able to change the rules in the middle of the year, but clients aren't able to change in the middle of the year. They can't change services. It's not fair, It
You're
just
so right, Ed. Those are wonderful points. Thank you for bringing those up.
Can I bring up a very maybe just me, but I am every time it feels like over the last couple of years that I go, I mean, I bless that, it's just for regular checkups and routines. But with my son, everyone has a portal, like there's no communication. And there are so many, I wish it was just like a universal integrated system where things could communicate, because I can't remember my dentist portal versus my primary care portal versus my women's health portal versus his pediatrics, his dentist. And there's this is insane. It's absolutely exhausting trying to keep up with that. So that's just.
You're so right. We really don't have a centralized area to share medical information. There is a health state by state. There is health sharing, but not every office participates in it. And it can be really time consuming and expensive for offices to share health information with this centralized location. So you're totally right. It can be really confusing and feel disjointed. And we still use fax, for God's sake, to change medical records between offices. So the fact that we have not evolved in order to have a more easy, secure way to upload and share information is totally a problem with the system.
I got one comment. I'm not sure if it's relevant, but
Sure.
I don't have a negative experience with doctors or doctors' offices or hospitals. I think the issue I have is when I go to the dentist and everything's in my chart or whatever they have today for electronic health records, every medicine that's prescribed from your primary doctor is available to your dentist or to your hygienist or to your whoever. And there should be boundaries between that information.
That's totally fair.
At least
Protected
in my
health
mind.
information.
Yeah.
They ideally should be able to ask for your consent for that, which
Absolutely.
should be happening.
No, it's just there.
Mm.
Yeah. So not sure that's your issue, but I'm just, since you're asking for feedback,
Yeah,
that's
no, I love that. That's very awesome feedback. Thank you.
I would hop on that, Tom, as well. I looked at my records that were listed, and there was misinformation on there for height and weight, and a number of things that were very alarming for me, because these things are on your medical records. And when you're looking for life insurance or long-term care or some other types of insurance, that information gets to those folks, and they could sit there and say, hey, it says here you were 240 pounds and now you weigh 215. How'd you lose 25 pounds, or what was that all about? And just simple things like that. It's just not fair, because there's misinformation that's put into people's records. So much stuff that you don't even know if you're not looking at your records on a regular basis.
That's a good point, Ed. We call that chart lore. It's kind of like what we have to confirm when we see you to make sure that all the things we've read from all of your previous providers has all been accurate. And that can get really confusing when someone has a record that's thousands of pages long that you have to sift through. Well, I appreciate all of your guys' input and feedback. That makes this really interactive, and it really helps me kind of target our discussion. I also got a comment from Ryan. I have read Throne of Glass. I do love that book series as well as all of her other ones. And she says that a big problem is that providers are being pushed to see more people in fewer number of minutes per person. Absolutely. That your medical assistants can take a long time to room you because they have a lot of checklists to get through. And so it can leave the doctor doctor or the NP or the PA with less time with the patient because they have to get through their checklist. You're totally right. There's all sorts of these things going on. So basically, I saw all these frustrations from my patients and from myself. So I left the traditional healthcare system, as you would call it, and I started my own practice, which opened in July of 2024. So it's been a little over 6 months. And my solution, and the solution that many doctors are moving toward, is called direct primary care. I don't know if anyone has heard of that before, but a lot of people ask me when they hear that, oh, is that concierge? I say, kind of not really. There is a difference between concierge and DPC in the sense that concierge physicians will often charge your insurance and charge you an exorbitant membership fee on the order of $10,000 to $25,000 a year typically. It is typically for ultra elite people. DPC is a membership fee only. We don't bill your insurance for anything. That is what pure direct primary care means. We essentially remove insurance from the equation and focus on a direct relationship between doctor and patient, which you can see in the graphic on this slide. You have all these insurance companies, regulators, admin people all getting in the way in the traditional healthcare model. And with DPC, there's nobody in the way between you and your doctor. It's just a simple relationship between the two of you. It makes things much more affordable because if you cut out all of the middlemen, you can cut out a lot of the cost for both doctors and patients. It is more transparent because there's not playing telephone between multiple different people. You don't get as much of that chart lore as Ed was talking about, where miscommunications in the medical record can happen. You get better access to your doctor because they see fewer people per day and spend more time with everybody, which in turn leads to a better relationship between patient and doctor, which both of them are more satisfied with. So I started my practice doing this, and to give you an idea, every direct primary care is different, but this is the pricing and services that include in my membership model. Every different practice will look slightly different. We have a kind of a saying in DPC, if you've seen one DPC, you've seen one DPC. We are all individually owned and operated, which means that there is variability. So for my practice, I see all ages because I'm board certified in family medicine from 0 to 100 plus years old. And I take care of all people on the spectrum of life. So for my children who are 18 and under, it's $50 a month. And my adults who are 19 years and older, it is $100 a month. And what that fee includes is wellness and preventive care. So basically any visit with me, chronic disease management, for example, if you have asthma, diabetes, blood pressure problems, any kind of long-term health problem, I manage that the same as any other primary care doctor. Acute care visits, which means sick visits, like say you cut your hand or you have a respiratory illness or you have palpitations and you don't know what's happening, then we have a visit for that. I don't charge copays ever for my patients. That monthly membership gets you as many visits as you need, as often as you need. And if you don't need to come in, then you don't need to come in. I try to be available same and next day for all of my patients, and that is because I keep my volume low and I spend a lot of time with my patients. Typically 30 to 60 minutes minimum. But today I spent almost 2 hours with somebody because it was a first visit and we really had a lot of stuff to cover because they hadn't been to a doctor in quite a while. Communication is also very important to me. I call, text, and email directly with my patients, and I use secure chart included messages to do that. So everything that patients send me is uploaded automatically into their chart and is secure with Face ID and passwords and other things like that so that people can't take my devices and access anything that is HIPAA related. What is not included in that membership fee are additional services like we draw labs in-house. I have a phlebotomist who does that. So for example, a CBC to check your red and white blood cells and platelets is $5. A thyroid lab for a TSH is $4. So I have cash prices for all of my labs. I also can send you to imaging centers to get MRIs, ultrasounds, etc., just like any doctor, and I give you cash prices for those that I've negotiated. I can order and dispense medications in my office. I just dispensed a medication to somebody at their visit today. and they are often a heck of a lot cheaper than they would be at your Walgreens CVS pharmacy. And I perform a lot of common procedures that are kind of becoming a lost art in medicine and primary care because primary care doctors are under such time constraints. They are sending out a lot of these procedures to other specialists who get actually paid more for them than the primary care doctor does. Some things I love doing are ingrown toenail removals, IUD placements and removals, joint injections, skin biopsies, stitches, all sorts of fun stuff. And I charge usually $15 for a procedure just to cover the cost of the supplies. You can see how we can save you money, like I mentioned, for pricing on labs. This was a person's cash prices in the black and white that they would have paid because they are uninsured if they just wanted to go through LabCorp's regular cash prices. And then with my pre-negotiated rates in green, we were able to save them $300 on 3 basic labs, a vitamin D level, a metabolic panel, and a CBC, which is a complete blood panel. So you can see that the cost savings can be pretty significant, and that $300 pays for 3 months of their membership with me already. Also on imaging, we can save you a lot of money there as well. So a typical copay for an MRI is on the order of several hundred to thousands of dollars, whereas my cash prices are typically anywhere from $400 to $600. You can kind of see all of the other imaging things as well. Also, the great thing that happens when you pay cash is if anyone's ever had back pain and needed an MRI of their back or spine, you typically have to get an X-ray first, so you're paying for that. You typically have to do 6 weeks of physical therapy for your insurance to approve it. And then your doctor has to fight with the insurance company for the authorization to go through for you to finally get on their schedule. If I think you need an MRI and you pay cash for it, I can get you in same or next day typically, and then I can get on with your treatment. So it really does remove all of the red tape when something is medically necessary and should not be pushed back by regulatory processes. Example of medication. This is one that I prescribe frequently. It's escitalopram. It's a antidepressant medication that's used to treat many different things, such as anxiety, OCD, depression. It on GoodRx, which is a coupon website for people that they can use for cash pay medications, costs about $25, $30, which is not that bad for a 3-month supply of medication. But through the wholesaler that I purchase it through, I can typically get it for around $5 for that same amount of medication. Rather than having to go to the pharmacy to pick it up, I keep it at my office. So you pick it up at your appointment or you just drop by. And rather than needing to go to your PCP for every refill, if it's something that someone's been stable on for a long time and they just need a refill, they typically just call, text, or email me. Sometimes we have a phone check-in to make sure that their symptoms are still doing well, that they don't have any unnecessary side effects, and that they still want to refill that. So we can take a lot of the headache out of the equation. What I'm really interested in is helping small businesses, because that's what a lot of us in the chamber are, small business owners, to improve not only their health as the owner, but the health of their employees as well. So I do offer employer partnerships with small businesses who have employees. If you have less than 6 employees or less than 50 employees in the state of Arizona, you don't have to provide benefits to people. However, this is a cool option that can be a lot less expensive than providing traditional health insurance to your employees and gives them a lot of benefits. Benefits you because you pay less for your employees. It also helps them be more productive at work because they feel better and they're healthier. They miss less work because they're sick less often. They can get into their doctor faster or even have a telehealth visit on their lunch break rather than having to drive in to the doctor's office. And it helps you attract and retain good employees because if they know that you're offering some kind of a benefit, even if it's not traditional insurance, then that helps them to know that they have their healthcare covered in a different way. For employee side, they get access to a high quality primary care office and doctor. They're healthier and happier with regular visits that actually help take care and solve their problems health-wise and prevent them, because I like preventive medicine a lot. And then they also receive an excellent health benefit for being your employee and for putting in their service to your organization. So if you have any questions, I'm happy to open it up to question time. If you have any future questions that you think of, I'll do free meet and greets. So if anyone's interested, they're 15 minutes. You can schedule them on my website, either phone or in person, to come see the office. You are also welcome to call my office number anytime to ask me questions. It's me who answers the phone at my own office, which people kind of freak out about when they call. They're like, hey, I'd like to talk to Dr. Sherman. And I'm like, yes, you are talking to Dr. Sherman. And then they're like, oh my gosh, I didn't think you answered the phone. I'm like, yeah, well, I am who works here. So it's me. And if anyone wants to sign up as a patient, there's a sign up link on our website. And yeah, if you have any questions, I'm open for that at this time.
I have a question for you.
Yes, please, Ed.
So if somebody has a health savings account,
Mhm.
they use that money to pay for your monthly fee and any other fees at your office.
100%.
So even if somebody offered benefits to their employees, they could offer this program as well, especially if they offer an HSA, and then
Yes.
they can actually pay for your services pre-tax under the HSA account.
Yes.
Wow. That's awesome.
I have a lot of patients who have health insurance. They just are tired of the system and getting treated like a number. And they want a more like personal relationship with their doctor that they can see when they need to see them and get the care that they deserve.
Thank you.
Anyone else?
Yeah. Hi, Jayme. I'm Evelyn. I'm with Cavitates Hardware. So I do have a question for my oldest daughter. She has lupus and her MS is in remission. So something like that. You have all these doctors, all these specialists, but nobody's communicating. It drives me insane. So I'm like, can we just get everybody together and figure out how we can get this done? But it doesn't work like that. So would something like this benefit my daughter? She lives in Las Vegas. So
Yes,
I mean,
and there are
does get a
places
lot
in
of
Vegas. Yeah.
Is there?
Yes,
Is there
there's a
anybody that you would recommend?
I don't know anyone off the top of my head, but there's a website called DPC Frontier, and they have a map where you can search by zip code. So anyone who is not in Arizona or even people who are in West Valley and everything, there's many of us who do this in the country. So DPC Frontier is who I'd recommend her looking on the map to find someone in her area, because people who like me are in this situation as physicians, we have more time to go to the specialist and communicate and call them and ask them to have a conference if we need to, because we do value that communication.
Thank you very much.
I have a couple questions in the chat that I'd like to read out. So Karen asked, there's no membership fee and you don't bill insurance. Yes. So patients pay the membership fee every month. I don't bill their insurance. If someone wants to use their insurance, they can absolutely use it for their labs, imaging, or medications at the pharmacy. I never touch the insurance part myself. So my patients will often tell me they want to run their labs through their insurance the first time. And then when they get that bill 6 to 12 weeks later, they're like, why did I do that? Your cash prices were 1/10 of the cost. And I'm like, well, now you know next time.
So Jayme, you mentioned something else about GoodRx.com.
Yes. Yeah.
And there are lots of people that don't know how super cool GoodRx.com is.
It is.
And what's great about it is if you just remember what we say, GoodRx.com, and put 3 W's in front of it, you can get to their website right now and see what those costs are. I have a group plan with a prescription drug program that GoodRx blows those prices away, and I never even use it. So lots of people don't even realize that they can get some really good prescription drug coverage without actually having coverage. Now, of course, if you've got some serious medications, that probably doesn't work as well. But for generics and some standard drugs, it works out really well. So you have a lot of good knowledge that you shared with everybody today. So thank you so much for your presentation.
Thank you, Ed. Yeah, GoodRx is fabulous. I actually use it very frequently. I don't carry every med in stock in my pharmacy here. And I also, if I don't have something in stock, like an antibiotic, and someone needs it that day, I'm not going to order it and wait for it to ship to my office to start them on it. So I will use GoodRx, and I actually will compare. Let's say someone really likes CVS, but I'm like, actually, so-and-so, Walgreens is a lot cheaper for this one on GoodRx. So I know you typically prescribe to CVS, but let's do Walgreens today because the price is better. So that's part of what I do in order to get my patients the best value.
Sherman, maybe you covered this and I missed it. Do you have to have a membership, or could you see people kind of one-off?
Depends on the DPC. For my practice personally, I've decided I don't do one-off visits. I have a 3-month minimum, and after that, month to month, it's up to you if you'd like to stay or cancel. So I really like long-term relationships with patients. I want to be your doctor for years, and I want to understand you as a human. So anytime that you get sick or have symptoms, I want to know about it and I want to be there helping. So the one-off visits are not in my model because I don't like that kind of a intermittent relationship, if you will.
Perfect. And I'm going to interject here, Dr. Sherman, if you could put your contact information in the notes section. And thank you for giving that presentation. That was very clear and very helpful. I appreciate you coming on.
Thank you so much, guys. I appreciate you guys listening.
Absolutely. And I'd love to introduce Brint Hiatt with Hiatt Law is our next presenter.
Hello there. Hello, everybody. I figured since we just got through talking about the issues with the healthcare system early on, we're going to turn to a more efficient system, the legal system, right? So everything works properly there, so we don't have to worry about that. But let me get my screen up. You guys know I'm joking, right? I have 5 kids. I'm going to make a few dad jokes. Please just bear with me. It happens. So let me get this up and running.
I was a little worried.
Oh, I know, right? Yes, a model of of efficiency, right? So I did find out that the Dr. Sherman was going to be presenting, so I wanted to have something that kind of went somewhat in alignment. And so I thought, let's talk about your business in from the context of making sure that it's fit, doing a checkup for you as entrepreneurs, small business owners. So first off, as I said, in a very efficient world, I have to give a disclaimer that this might be considered attorney advertising in some jurisdictions, and this is not advertising. I'm not your attorney, but I'm going to go ahead and jump over on that. A little bit about me, about my firm. We've been around since 2017. We're located actually just around the corner from the Mesa Chamber of Commerce. We have a focus on small business owners and entrepreneurs. We're very, very close. There's our information. It's also going to be at the back of this presentation, so you can jot this down or wait until the end. Our firm, we are a fairly small shop, a little bit larger than what you see on the picture. We have some team members both locally and in other places. And we help entrepreneurs and small business owners to set up the business the right way, solid foundation, legally protect what you're working so hard to build. Basically, we help you spend less time stressing, more time actually building your business. What makes our firm unique is that our attorneys actually have real business experience. We have real subject matter domain expertise. We understand the decisions that you're making because most of us have had to make them from the same side of the table as you as a small business owner. So what we do, just some of the services we provide, entity filings, formations, contracts, and, employment agreements, strategy, helping out with, small run, usually on the smaller side for investor documents. We also do a little bit of estate planning as well. We treat a lot of the estate planning, like the trusts and such, as part of your strategy to protect your assets and build your wealth. So about myself, I already kind of shared a little bit. I have 5 kids. I have 2 sets of twins. We have a very full house. I also have 2 dogs, a desert tortoise, and we have some chickens in the backyard. So it's a very, very full property. I have many years working with startups as my background. That's why we do what we do. Absolutely, love working with entrepreneurs, small business owners. It's what feeds me, gives me energy to be able to do what it is that I do, be able to go home to my kids and actually be excited about what Daddy does. So So let's get into it. So as far as doing an entrepreneur's checkup, I figure there's about 5 questions. Obviously, there's more than this. You know, the soul of law really is the minutia, the trivia, but we're not going to get into the trivia. We're going to kind of use broad strokes here. So the 5 questions are: do you have the right business structure for tax and liability protection? Are your contracts clear and enforceable? Is your IP, your intellectual property, properly protected? Do you comply with local and state regulations? And do you have a plan for business continuity or succession? If you can answer all of these questions, you are in a good spot. If you can't answer all of these questions, that doesn't mean that you're in a bad spot. It just means that it's something that needs to be on your radar. It's something that you probably need to look at, probably need to plan for. And it's not a big deal. I mean, it might be a big deal, but it's not always a big deal if you don't have the answer to something. It just might be something you haven't heard about yet, that it hasn't hit you yet. And you know, it's not a problem you've ever had to face, but how much better to be able to start looking at these questions now and planning ahead for the future, so that you already have made some of the decisions that you're going to need to make when you get to those points. So I'm comparing the business to the body right here. In this case, in this scenario, your business entity would act as your skeleton, your structure. It gives the actual structure to the body so that you don't just fall apart, right? Your contracts, oh gosh, I missed that one. Your contracts are actually the muscle of the business. I got a typo there, but it's the musculature of the business, the what holds makes your body move and gives you that flexibility to be able to move things the way that you want to move things. Your intellectual property would be your immunity. We often look at things like patents, trademarks, copyrights as your unfair advantage that you might have over your competitors in the marketplace. And so that makes your brand immune from somebody who might come in and dilute your brand, which is your brand, your business identity. And then your regulatory compliance, those would be the wellness checks. And neglecting any part of your business's legal health can lead to costly sick days. You don't want to have to check out because you have neglected one of these areas of your business. So let's go through them. So do you have the right legal structure for your business? Now we have LLCs, corporations, partnerships are kind of the typical. I keep getting questions about sole proprietorship. And has anybody here ever been told that a sole proprietorship is the right way to do a business? I hope not. It's really not. I mean, it's really the lack of a structure. It's the lack of a limitation of liability shield. And if there's anything that you might be doing that that might actually create liability for yourself and risk of harm and damage, you want to have a limitation of liability shield around that. And so you're talking about LLCs, corporations, and partnerships. This will allow you to protect yourself from liability, also create some tax optimization, and then also it gives you credibility. If you just like walk out and decide that you're going to start hanging out a shingle and practicing, you're not going to be as impressive to the marketplace as somebody who actually is acting as the agent with authority on behalf of a business entity that is building and growing its own business identity. So again, think of it like having good posture, and good structure prevents future pain. And just like, your skeleton, your musculature, your skeleton and such, you need to make sure that you have the appropriate documents set up so that you have it set up. It's not enough to actually just set up an LLC or set up a corporation. If your goal is to prevent yourself from having liability risks, to prevent your personal assets from being raided by creditors, you actually have to do the work to set it up right. So for an LLC, we're talking about having an operating agreement in place, making sure that you are maintaining that entity. Corporation, you're going to have your bylaws, your shareholder agreements, your articles of incorporation. Partnership, you're going to have your partnership agreement. For sole proprietorship, I mean, there might be some limited cases where a sole proprietorship might make sense, but for the most part, where you are dealing with a situation where you could be sued, I would highly recommend some type of limitation of liability shield. So let's move on to the muscles of your business. Contracts, they ensure that your business can lift heavy loads, because the business itself can't do anything, right? It needs people. It still needs people. And people do things because of the promises that they are made through a contract. It could be verbal, it could be written. I'm going to generally say that written is better than verbal. You're going to need to have owner agreements. So if you have partners, you're making sure you have an operating agreement. Or if you have partners in a partnership, that you have a partnership agreement, or the bylaws that they clearly state, what the rules are for the shareholders to be able to interact amongst each other. But you're also going to need client agreements, vendor contracts, employment agreements, making sure that they have key provisions listed in the agreements, because if there's ambiguity because something was not clear in your contract, or maybe there's missing terms. A common thing that I see is like that contracts may not have a provision for terminating, and that can cause real challenges, because contracts, if you think about it, are just a picture of a relationship written down in word form. They are the rules of the relationship if you could define them with words. That's literally what they are. And if it's ambiguous and you don't know how that relationship is going to go, it could be costly. You know, if you don't want to find out further down the road that you don't get along with this person. You need to have these clear guidelines and rules in place. I like to say, for a lot of my founders that come in, these co-founder groups, I say, listen, we're going to stimulate some conflict here. And that always throws people off, because they don't want to stimulate conflict. We generally run from conflict, but it is better to stimulate a little bit of conflict and find out what is important to each of you, so that if something happens further on down the line when the risks are so much higher, it's better to have already set those minimum standards, because that's the minimum standard of care, the minimum protocols that you're going to use to interact with each other, because you can always do better. You can always amend. If you're getting along well, you can always update that agreement, right? It's only when things go bad that you're going to be very, very glad that these provisions are in place. So flex those muscles. Strong contracts keep your business going. Now, for the brand protection, immunity system. It's very important. How many business owners here, how many people here own a website? If you have a website, you got intellectual property. You have copyrighted works. You might have written blogs, Facebook posts, Instagram posts. All of this stuff is intellectual property. If you have a brand, your logo, your actual slogans that you use, these could be considered intellectual property. And so you should be creating them. You should be creating these unfair advantages, because if you have a well-defined brand, you're going to have a much stronger advantage in the marketplace over somebody who does not. So register your trademarks to protect your business identity, protect your ability to operate. I don't have a slide for this, but you might have heard the story of Burger King, and Burger King is a franchise. It's not the first Burger King that's out there, though. There is an original Burger King that was there before. They had a big, long lawsuit about it, and that Burger King now cannot leave a 20 square mile radius from its original location, whereas the Burger King that came after, that got the trademark, they basically won the rest of the country. So it is very important to register your brands, register your intellectual property, and then beware competitors that might be stealing your name and logo. It can be very easy for people to basically borrow a competitor's goodwill, and if you don't police it, you could easily be deemed to have abandoned that, and basically they allow them to dilute your brand in the marketplace. And so basically all of this intellectual property, your brand, is the lifeblood of your business. Let's keep it healthy. So regulatory compliance. Hey, you got to go see Dr. Sherman. You need to get that regular checkup. And for legal situations, you need to make sure that you're getting the tests done, the blood work, your annual renewals, business licenses, your permits, employment laws, making sure that you are doing regular checkups to make sure that you're continuing in compliance with these laws, making sure that you have your tax filings done. It's not exciting, it's not glamorous, but it does prevent the bigger issues. The last thing you want to have happen is you get a lawsuit after you've had your entity administratively dissolved because you did not keep up your business, and now you no longer have a limitation of liability shield to protect you. So making sure that you are taking the time to take a look at your business and see how things are going. I mean, let's be honest. I mean, nobody really stays the same throughout their life, right? I mean, the only constant is that things change. People grow older, new people come into their life, people leave your life. And as your situation and circumstances change, you should be doing an update and checkup to make sure that what you want today is the same, or what you want is going to be the same as what you want in the future, or if it has changed, that you make updates to your documents, updates to your filings, so that you can maintain that strength. And that strength can continue to future generations. And so you want to make sure you're doing some future planning, succession continuity. And so think about buy-sell agreements with your partner, setting up trust, identifying key successors in your business plan. This is like your business retirement plan. Don't be unprepared. And so with that, to kind of finalize this. So for the doctors for your business, these are your trusted advisors. Every business owner should have professional advisors. And I know this sounds self-serving because I'm a lawyer, I'm a legal advisor, business advisor, yes, but you should have advisors for lots of different areas. And I'm sure there are other areas that are not mentioned here. I might even go so far as to say you need to have your health checked on, because if you don't have your health, chances are your business is not going to do very well. If you don't have a good way to make sure that you are working well, your business is ultimately gonna fail. You're not gonna have that type of energy. But taxes, insurance, financial, bookkeeping, strategy, obviously legal, right? Make sure you are talking to your advisors. We are your trainers, your primary care physicians, to be able to help make sure that your business is going smoothly, going properly, going the direction that you want. Because ultimately, we want to make sure that all of these things in your business are going the way that you want to have happen, and not so that they're your decisions, not a decision that a court or somebody else might make for you. Okay, so you have the power, you have the opportunity right now to make sure that these things are going in your favor, and that at least it's your decision, not something that's foisted upon you. So again, you don't have to have an answer to every single thing here, but hopefully I've been able to put a few things on your radar, and we would love to be able to chat with you about anything, any questions that you might have. Here's my contact information. Does anybody have any questions? If not, I'll turn it back over to Trish. I see Steven has a hand. What's up?
Yeah, so Brent, we've talked actually, I know outside of this meeting about different things, but you said a term that kind of jumped out at me. What entails policing, like my brand, my IP, my trademarks? What does that mean? Does that mean I'm sitting on and doing a Google search? I legit don't know, and I'm usually pretty good with technology stuff. And so I'm like,
Yeah.
how do I police my brand and my IP?
That is a great question, and generally it's pretty close to what you just mentioned. It's making sure that you are aware of what is going on in the marketplace. If you have a brand, a very common thing is, if you notice that someone is filing a trademark that's very similar to yours, that you make sure that you contest it. There's a contestation process. You can contest it with you can oppose it. It's called opposition, that you can do with the USPTO. And then if you find somebody who's using a brand that is directly just like right on top of yours or similar to yours, making sure you're sending them cease and desists. I mean, listen, it's going to be on a kind of a reasonable basis. It doesn't necessarily mean that you're going to have to pull out all the stops and file like massive lawsuits, but at least taking steps, based on the reasonableness of your situation, so that you make sure that you are watching to see what other people have. So policing your brand in particular is usually taking a look and seeing what else is out there. Like if for example, in Dr. Sherman's Engaged Health, if there was like an Engaged Health out there that maybe has they're going in a different brand, but it's very, very similar, something like that would need to be policed. It would need to be somebody would probably need to back down, or you would create a coexist agreement. It doesn't necessarily mean that it's winner take all, but it could be that you create an agreement amongst competitors to I'm going to operate in this space, you operate in that space, and we're going to agree to coexist. That is also a possibility. So it doesn't necessarily mean that you're going to take somebody down, because that's expensive, right? Like having to go through an expensive lawsuit to do that. But you can easily find, every so often doing a Google search, like you said, that's a great suggestion. You can do Google searches for your website text and find out if somebody might have scraped your data. And there are monitors and watchdogs out there that you can pay to kind of look out for key intellectual property that you have. It may not be reasonable for you to do as a very, very small business, but as you grow, it could be a step that you start to put in place. As I mentioned, things are, relationships, agreements are basically snapshots, just like a snapshot of a family. You don't want to take a family photo one time and never take another family photo again. These things evolve and your business evolves. And so what you should do to police it might also need to evolve. Does that
Okay.
help answer your
Yeah.
question? Ad
Oh, that
nauseam.
did.
Anybody else?
Yeah, I had a question. Thank you for the information. You mentioned you do at least dabble in estate planning or do some bit of estate planning. Just, I mean, as a financial planning firm, We are always referring people to estate planners. Kind of what is your level, or what does that process look like if someone were to come to you with estate planning questions and guidance?
Yeah, so I mean, the estate planning process is probably going to be pretty similar to what other firms do that are more estate planning. Our niche just tends to be more geared towards small business owners and helping them to create the value in their business, but then also to pass that legacy on, uh, keep that value locked up for their families and loved ones and where they want it to go. But our deliverables are just about the same. We do a will, revocable trust, powers of attorney, healthcare documentation. All of that stuff is important, and it's important in the life of a business owner just as much as it's important in the life of a family. Just a small anecdote: I have a client who she was a medical billing specialist, and this person, did a lot of billing for doctors' offices, had several employees that fulfilled the function of that. This person unfortunately fell under basically fell ill during COVID. Spent 3 weeks intubated in the ICU and another several weeks in the ICU, just like trying to get well. This person did not have an estate plan. And unfortunately, we tried to get power of attorney. We tried to get certain things but this person was not able um, to basically keep the business going. And so this person walked out of the hospital and had pretty much lost their employees, couldn't make payroll for however long, and couldn't do the services for her clients. And so you walk out to a lawsuit as opposed, instead of being able to get ready, get well. And that's just a shame, right? Because with just a simple document in place, the bank would have allowed somebody to be able to come in and pay the payroll and pay the bills and keep things going and have avoided all of that. So I mean, this is a very important topic, and it's not just for people that are looking for end of life. It's also for people who need to make sure that their business will continue with them not being there. I mean, let's be real. Every small business owner, if you have employees, you have people that count on you. If you haven't done your homework, if you haven't done your research and your planning, you are potentially failing them, and you're gambling with all of their lives, their livelihood, because just by failing to put in place some simple documentation.
That's a true story. I've got a client who we've been begging him to do his estate planning, begging him, and just hasn't gotten around to it. And then right around the new year, he had a major health scare, and he calls me and he's like, "Yep, made an appointment with an attorney. I'm going to do that now." Crazy world.
It is. And hopefully, for most of us, we hope that we will have that opportunity to rectify things and that it's just going to be a minor blip in our life. But like Dr. Sherman was talking about, we that like sometimes heart attacks can be the best thing that happened to somebody, right? As long as they survive. They might turn their life around and become incredibly healthy and make good decisions going forward. But that's a big if. So, all of these things that we're talking about right here, they're all ifs. We hope that you never need it, right? We hope that we hope we figure out the secret of immortality before you ever have to use your will, right? But being that the likelihood of that is fairly low, and the likelihood of something happening to somebody in your plan is fairly high at some point, right? I mean, the likelihood of you walking out and getting hit by a car on any given day is very low. But something happening to somebody that you love or that would be involved in the plan over the next 10 years, like that's a pretty high odds. Like, let's not leave that to chance.
True. I apologize. I had to turn off my camera. I had to jump in the car to head home, and didn't want you guys staring at my nose as I had my phone on my lap.
You're all good. You're all good. Do I have any other questions, or am I turning this back over? Thank you for the questions. Those are great. Oh, how do I stop share? There we go.
Thank you, Brent. I really appreciate you coming on here and sharing your info, very important info. Is there anyone that has any final questions or suggestions, or actually if anybody has anything cool going on at the place of business, promotions, anything you like to share at this time? This goes out to YouTube, so this is your time to shine.
We have a couple promotions, Trish. We're running a buy one, get one free wiper blades. I believe it runs through the 18th. And we have a $150 off brake special, $75 per axle. So if you need brakes all around, $150 off. That runs through February 18th as well.
Awesome. Thank you.
I do. At our Cabot's Ace hardware stores, which we have one in Mesa. That's Cabot's, Kabats. We have one in Mesa, Apache Junction, and Santan and Yuma. And right now they're running no tax on any of the grills. That's Green Eggs, Traeger's, Weber. So you save a lot of money not paying taxes. And that's all the way till, we can't say Super Bowl on our advertisement, but till the big game. But yeah, come get a grill.
That's awesome. Anyone else? We're all good?
Thank you for having us. I appreciated doing the presentation. Thank you all for your questions and participation.
Yeah, Brent, if you could put if you haven't already, put your information where someone can copy and paste. And also, all of you can do that if you choose. We've got a minute left. Everyone can put their information in there if they want to.
I accidentally did it on.
Ryan, do you work for the Maricopa County then? Maricopa County Small Business Advocate.
Yeah, I do.
I missed your intro. Sorry.
There you are, Stephen. Yeah, I do. I work for the county in the Office of
Okay.
Retirement Services.
Yeah, throw your info on there. I'm curious what that relationships look like. I appreciate it.
For sure. Yeah. Our program is to assist all of you guys in, getting business, maybe getting a contract with us. And, we do a lot of business and we like to give it to our small and local businesses and support the community instead of always just sourcing out to some of the bigger ones. I'm setting that right now.
Got it. Thank you.
Yeah. I'm gonna put a program email in here too. That one's my more personal internal one. But this will be the program direct.
So if I have like memes or something, I send it to your personal Ryan.Dixon one, right?
Absolutely.
Okay.
Also, I'm going to be sending out a survey. If you all could fill the survey out, it's essentially feedback of what you would like to see in future meetings and what you thought of this meeting and just moving forward. We were thinking about moving this meeting to in person at some point, but we also see that there is a need to have this meeting continue on Zoom. A lot of businesses can't get out of their four walls. So this has been really helpful for that. But I do also see the value in meeting in person. Anybody else? All right, if everyone.
No, thanks for hosting this, Trish. I appreciate it.
No, absolutely, Stephen. Thanks for coming on. Thank you for all of you. I appreciate you, and it just adds a lot of value to these meetings. And if you can think of future presenters, of someone that's in the chamber that would be a great asset to this, send them my way.
Great. Thank you, Trish.
No, thank
Thanks,
you.
Trish.
Thank you guys. And that's it. It's a
See
wrap.
y'all later.
Going.
Bye.
Adios.
Bye, guys.
Thanks.